And I'd like to ask now if the live stream has started.
One moment, Madam Chair, and Madam Chair.
Welcome to this meeting.
No, there's the interrupt button and then there's your button.
Welcome to this meeting of the Health and Wellbeing Board being held on Monday, 25th of September 2023. For those present in the meeting room, if the fire alarm sounds, please leave the building by the nearest exit and proceed to the assembly area in the car park. The agenda papers and other relevant information for this meeting are available for public view on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. To ensure that recording quality is maintained, please speak as clearly as possible and keep background noise to a minimum. Please ensure that mobile phones and other devices are turned to silent. Others are permitted to film, photograph and record our public meetings, provided it does not disrupt the business of the meeting. If there are any members of the public present who do not wish to be filmed or photographed, please raise your hand now so that any such person filming or photographing may be made aware. The procedure and etiquette for the meeting will be that voting will be undertaken by a show of hands in the room, and only committee members present may vote. We may have a number of members in attendance as virtual participants, and can I request that they use the raised hand function within the system if they wish to contribute. Do we have any apologies?
We've received apologies from John Butlin, Councillor Ivan Powell and Mark Yates.
Thank you. Do we have any name substitutes?
Lorraine Baker is acting as a substitute for Susan Harris to represent Herefordshire and Worcestershire NHS Trust.
Do we have any members wishing to declare any Schedule 1, Schedule 2 or other interests in any agenda item? Item 4. The minutes of the meeting held on the 26th of June 2023 are included in the agenda pack at pages 9 to 18 for approval. I move that the minutes subject to the amendment, any amendment, be signed as a correct record. Do we have any amendments? No? I approve them. Does anyone, all in favour? Any against? No. Item 7, 5 rather, is any questions from members of the public?
No questions received, Chair.
Item 6, any questions from councillors?
No questions.
Item 7 is the appointment of the vice chair. I just want to apologise to the original agenda as it went out in the public, that it was probably a little unclear as to who may or may not be vice chair of this committee. Section 2.8.10 of Herefordshire Council's constitution states that one of the board members representing NHS Herefordshire and Worcestershire Integrated Care Board, the ICB, will be appointed vice chairperson annually by the board. I would like to propose that Jane Ives remains in her position as vice chair. Do I have a seconder? Simon Trickett.
Yeah, we're very happy to second that, Chair, on behalf of the ICB.
Thank you. Any other comments? Do we now, all those in favour? Any against? Any abstentions? There you go, Jane. Thank you. Item 8 is the Health and Wellbeing Board Terms of Reference. And to present this item, we have Matt Pearce, Director of Public Health.
Thank you, Chair. So just in front of you in the papers is just an update of the terms of reference. So I understand that this actually has to go to full council for approval, but this was just a review of the existing terms of reference. Main changes were updates around names of organisations, so obviously CCG to ICB. There are a couple of errors which I've already picked up, which is Taurus isn't included as a member of the board, so assuming the board are happy with that, we might want to update and reflect that. Apologies to Dr. Hearn for that. And the other one is we've got Thames Valley Police instead of West Mercia Police, so apologies for my police colleagues over there. So we just need to update to reflect that. The other main addition is a voluntary and community sector representation as well. So a few months back, the Community Partnership recommended Stephen Brewster as a voluntary community sector representative. And I hope you'd all agree, I think having a representative of the voluntary and community sector is really important for the work of the board. So I don't have much more than that, so I'm happy to take comments and questions before this goes to council to be signed off and ratified.
Can you say your name?
Yeah, well, I need to this. Used to using the equipment again. So Kevin Crompton, the Chair of the Safeguarding Board. I'm chatting to Hilary. Just clarify, am I here as an observer or I'm a member? So Henry thought I was a member, because if so, I need to be added to the list.
So whether you were a member, yeah, I think you would be a member. Is it not written in the terms of reference?
It just needs to be added.
Yeah, that's all we need to make, assuming everyone's happy with that.
Yeah.
Arrangement.
Okay.
Mike Hearn, just to clarify, Matt, rather than Taurus, it's Herefordshire General Practice. Just so we're clear on that, really, because I'm keen that Taurus is just an organisation which supports general practice, and that's what I think my capacity is for all of general practice.
Okay. Anybody else got any comments to make on this item? No? Okay. Therefore, the recommendation is that the Health and Wellbeing Board considers the revised terms of reference and Appendix 1 and provides commentary for being ratified by Council. Can I please have a proposal and recommendations? I'm happy to propose them. Anybody second that? Jane? And we now go to the vote. All those in favour? Any against? Any abstentions? It's fine. Thank you. We now move on to item 9, which is the Herefordshire's Better Care Fund, BCF, Integration Plan 2023 to 2025. And just to say to those who don't know, we received on the 20th of September from NHS England a letter stating that our plan has been classified as approved. Okay? This is now going to be presented by Hilary Hall, Corporate Director for Community Wellbeing, and I believe that also attending virtually is Adrian Griffiths, who is a business partner for Economy and Environment, who will add any points that he might wish to during the course of the debate. Thank you. Thank you.
Thank you, Chair. By way of background, the Better Care Fund, or BCF, is a joint plan between the Integrated Care Board and the Council. It's owned by the Health and Wellbeing Board and governed by an agreement under Section 75 of the NHS Act. So what's in front of you is a 2-year plan for 2023 to 2025 for meeting the national conditions and objectives, a 2-year spending plan and a 1-year plan for key performance metrics and capacity and demand plans, with an expectation that those plans are refreshed in 2024-25. The Better Care Fund itself is made up of several funding streams. There's the minimum contribution from the NHS, the Improved Better Care Fund, or IBCF, the Disabled Facilities Grant, and the Adult Social Care Discharge Fund. And the object of the plan is to reflect local health and care priorities. As it states in the report, One Herefordshire Partnership has agreed a memorandum of understanding with the ICB that will see responsibility for planning and performance management of the BCF delegated locally, and we're the first area in England to do this. The national conditions that we need to meet are to have a jointly agreed plan, to implement the 2 policy objectives, one of which is around enabling people to stay well, safe and independent at home for longer, and providing the right care at the right place at the right time, and also maintaining the NHS's contribution to adult social care, and also investment in NHS commissioned out-of-hospital services. In terms of the key performance metrics, these have been reviewed. There are now 5 metrics. The first is around older people being admitted to residential or nursing care per 100,000 population, unplanned admissions for chronic ambulatory care sensitive conditions, emergency hospital admissions for people over 65, improving the number of people discharged home and the proportion of people who are still at home 91 days after discharge from hospital into reablement services. So as the Chair has said, that the plan was submitted to the NHS and has been marked as approved. There are still some elements around the finances that need clarification and sign-off between the ICB and the Council, and I know that the Chief Executive of the Council is meeting with Simon, the Chief Executive of the ICB, to resolve those financial. The overall envelope remains the same, it's about the allocation within that, and that still remains to be resolved, but the narrative plan itself is agreed between both parties and is here for formal approval today. Thank you, Chair.
Thank you, Hilary. And is there anybody here who'd like to comment on the report?
Yeah, thanks, Chair, and thanks, Hilary, and thanks to the officers for all the work that goes into this. I notice it's about 150 odd pages of our pack, isn't it? And that doesn't magic itself up overnight. That's involved a lot of effort and thought and consideration. So credit to Hilary's team in particular for their work in pulling this together in partnership. It's great that we've had approval from NHS England, so that isn't automatic. So this is a big chunk of public money. We have our local processes to come up with our local plans, but there is a national, because it's part of the NHS funding streams, there's a national approval process. So the fact we've gone through that is good. I think my only point for the committee is I think we've got some work to do in this area. We really believe in the local arrangements and One Herefordshire Partnership and the work that Jane, Hilary, Mike and others do to try and manage this. I'd really like to see some more development work in this area over the next 12 months. Specifically, we have an over-reliance in the discharge side of things on spot purchasing placements, so we're just buying placements in nursing homes, when actually we need to manage the marketplace better and we need to be clearer about our longer-term arrangements and then to put agreements in place with people who can help us provide those arrangements. That's much better for patients and service users, and it's much more economical actually than short-term spot purchasing. So despite the fact we've got our plan approved, it just would be right to flag there's some work to do actually in this area, and I know that colleagues will push that forward, and maybe it'd be something you could consider again at a future meeting, Chair, just where we've got to with that work. But thank you for the work and well done on it being approved.
Before I call upon Hilary to respond to that, we have discussed that at Howlish, haven't we, as spot purchasing?
Yes, you're absolutely right. We don't want to be reliant on spot purchasing, and the whole thrust of the work we've been doing is to try and move away from that. We still need some requirement for it, but we need to have a much better balance in the market between that, and also actually enabling more people to come home and be supported in their home rather than moving into residential and nursing care. Clearly that's appropriate where it's appropriate, but we don't want an over-reliance on it. And it's also about those services we have working with the community and voluntary sector as well to support people to stay in their own homes. So yes, there is a whole piece of work that we need to do around this going forward. I'm sure now it's part of that local arrangement through the MOU. We have better oversight of the work that we will be doing going forward.
Anybody else want to comment? Jane?
If I could just add to that, so this is really exciting in terms of the delegation to our place-based partnership. Until Hilary said, we don't think there's anywhere else in the country who's taken that step, and it's a sign of our maturity in the way that we work together. because there's a lot more we can do, I believe, with the resources that we've got in this pot, and we can really drive efficiency and effectiveness of how we use those resources by having a much more local ownership of that, and to really drive our integrated working, the way that our teams work together, whether that's in PCNs or whether that's between hospital staff and local authority staff. The thing that isn't in the pack, and it's a matter of detail in a way, is that the way that we're going to hold ourselves to account with this is something called ICE, the Integrated Care Executive, so a way where we come together and look at the detail of this in an integrated way as we move forward. And again, it's something that we've developed over time, and again has got to a maturity where we believe that can now take that on. And as part of that, there are, as Hilary went through, there's 5 national objectives for this, but actually there's a lot more under the detail of that we need to keep an eye on, the key performance indicators that will show us whether we're doing the things that we want to do with this fund. So there's a lot more work to be done, but this is an exciting first step, and hopefully we can sort of get the detail of the money agreed quickly, because that is an important thing, just to make sure we've nailed the detail in this in the next hopefully few days.
Yes, I think that's the important thing, and I'm hopeful that outside of this meeting, people will get together and be able to resolve this amicably, and then going forward, it'll be fine. Anybody else want to make any comment? No? Okay, well then we move then to the recommendations, which are that the Better Care Fund 2023-2025 Narrative Plan Appendix 1, Planning Template Appendix 2, and the ICB Discharge Template Appendix 3 be approved, and B, that the ongoing work to support the integrated health and care provision that is funded by the BCF is noted by the board. I'll propose that, and I'll have a seconder. Simon. All those in favour? Any against? Any abstentions? Right, we now move on to item 10, which is the most appropriate agency. And I'd like to welcome John Campion, the West Mercia Police and Crime Commissioner, to the meeting. John and I have known each other
20 years?
30 years.
20 years.
20 years, is it only?
No.
Oh, you're younger than I am then, John. 20 years, when we were both in local government together. So it's really nice to have you here in Herefordshire, and I hope you enjoy your visit to this beautiful county.
Thank you, Madam Chairman. 30 years ago, I was at school, just about to sit my A-levels from memory.
Did you really have to say that?
As I assume were you, Madam Chairman, so in common too. I'm really grateful for the board's time today, and we've submitted a paper and an appendix. And it's an issue that I know isn't brand new to the board, but I think incumbent on me as Commissioner, just in my partnership role, my convening role, and I'm going around the different parts of West Mercia to the different health and wellbeing boards, because this for me is a really important issue in relation to how different services work. I'm incredibly proud of West Mercia Police and their role within society, but I also know that there is more that we should and could be doing in terms of the work that we are statutorily required to do. And part of my challenge is as Commissioner is that for many years policing has been operating as the safety net, and indeed safety nets are there for a reason, to be when other services and indeed often becoming the service of last resort. But when that safety net is used consistently, it is no longer a safety net, is it? It is a service in its own right. And one of the focuses from government following their investment in 20,000 new additional police officers is that they quite rightly want to be able to get the benefit from that, primarily around ensuring that crime is focused upon and indeed the King's peace is kept. Now, I'm not aware of a perfect public service. but all agencies represented around this table have their challenges, and the police are no different. So therefore, it is vital that everybody works together and keeps our community safe. That is absolutely something I and the Chief Constable are still committed to. But there does have to be a reset around ensuring that the police are spending the vast majority of their time on their core statutory duties, as I know the other bodies around this table would want to do the same. And the right care, right person, or MAA, as it's sometimes described, is about ensuring that the police are deploying and responding to those right services and right calls. Within the policy that's summarised as an appendix, you'll see the areas of focus that it has, and there is a large social care and health focus around it. And I also don't come here to say this is an enormous part, dominant part of West Mercia Police's demand. Of course it isn't, but it is a significant part, and indeed it is one that West Mercia Police is often ill-equipped to respond to, because it isn't its statutory purpose. It doesn't train for responding to a lot of these issues. So why am I here today? Because you will have heard MMA before. You will have heard some of the adjustments afterwards. I would, in particular, on 24, bullet point 24, just ask partners, and it's a matter for you, Madam Chairman, as to whether it's part of a discussion today or how it goes forward. But I would want us to be reassured around some of the questions that are there, because some things in terms of in different organisations, preparation for full implementation will take longer. Some things would be more simple. Something would require greater clarification or coordination. And I know from the work I've been in the north, where this was first proven to be a success, that the partnership element is really important for it to be successful, because ultimately I want the person in need to get the right care. And one of the questions or offers is as to whether or not a more formal governance forum for this type of work would be important. Now, obviously, my element would be about MAA into it, but there could be other parts of policing, other parts of public service that might be appropriate for it. But as I say, one of the reasons for being here is to make sure, first of all, that everybody knows the police's position, but second of all, we challenge ourselves to see whether or not we are taking the maximum opportunity for the policy change and indeed the national focus to ensure we're doing the best for our citizens who are ultimately asking the state for help. And we are the bodies represented around this table who need to provide that help.
Thank you, John. I think the best way really to deal with this is probably, as John has pointed out, which is on page 130, which is the item 24, which is the bullet points that he's put, which basically set out, are we fully satisfied of the implications of this policy? Do we understand what the police are doing, and do we endorse it? And there are various other items on there that I think we need to address. So first of all, are partners satisfied that they fully understand the implications of the policy for themselves from both a strategic and an operational perspective? Does anybody want to speak on that particular point? Yes.
Chair Kevin, just one question. What's the mechanism or the multi-agency discussion over an incident that decides, how does that actually operate in practice? I couldn't glean that from the paper. So police get a call, somebody is kicking off one better expression, members of the public are worried. Where's the conversation take place that says this is a mental health response or a police response or a social work? How does that happen here?
It's sorry, Madam Chairman. It's interesting because, of course, this is all happening within the police's remit, isn't it? It is demand placed at the police's door, so they are using their deployment policies and indeed determining whether or not it is for them to deploy. And we don't have in West Mercia multi-agency deployment, even where we have fire services based in the same control room. It is still a separate function. And part of the reason why I'm offering to be maybe a little more skin in the game around whether or not we need another forum to look at these kind of things is to see whether there should be a trajectory to look at, because the tactical deployment is a long way away from my responsibility, but I still have to have reassurance that it works. And my fear is, if I'm being blunt with you, is that police quite rightly will determine not for us to go to, but there is still that person in need. And I also recognise if police still keep going to person in need when they shouldn't be going, it's never going to change, isn't it? So it's how we get that balance of change whilst indeed keeping people on the journey. If I was completely reassured that all of the things were hunky-dory and in place, I wouldn't be in Herefordshire this afternoon, as lovely as it is. And so your question is probably at the nub of what should be happening afterwards, but I can't see the roadmap to how we get there.
John, I mean, the other thing is, from the point of view of a member of the public, at the present moment in time, 9 times out of 10, if somebody recognises or is involved with somebody that's going through a mental health crisis, they will dial 999. That's what they will do. Now, whatever the policy may become, do you believe there's going to be some confusion going forward when this policy starts to be made more public as to who do I now contact? Do I contact the police? Do I contact the health service? Do I contact the mental health trust? Do I contact the council? And that's where I'm really struggling with how this is going to work in practice, because I think human nature is such that people will still see it. If someone had an accident, they dial 999 and call an ambulance. If somebody's house is on fire, they call the fire brigade. If somebody's off and had a mental breakdown, they call the police. And I just don't know how that will change.
So again, another excellent point to which I haven't got an answer, but I have got some observations. I think the police are very accessible. So we answer the phone very quickly. We take the report very quickly. Not all emergency services are in that position, and we can often send somebody fairly quickly in the grand scheme of things as well. That doesn't happen when you ring an ambulance.
No.
It happens in a very, very different way. They apply the Thrive version that's set out in here in an absolute much more purist sense, because they have a huge amount of demand and a finite resource to which they are wanting to make the biggest impact with. Well, it is no different to what the police are trying to do ultimately, but I don't think there is and this is where my ignorance could be coming to the front. I don't think we have got good emergency front door access to some of the services that we might need under MAA, and indeed if they are there, I don't think they're very well particularly known. And how the inappropriate demand getting presented to one front door, how it gets to the right front door, should be the partners to sort out, not necessarily the person in need have to be rerouted back around. So one of my other very interesting bits is how that demand is rerouted without that agency that's receiving the report ending up with the job to respond to.
Thank you. Yeah, Mike and Herefordshire General Practice. Firstly, thank you for bringing this, because this has been discussed actually at a couple of forums that I've been at with clinical colleagues, in particular General Practice and mental health colleagues, and who've expressed quite a lot of concern around the potential gaps that this may leave, which you quite understandably allude to. So particularly with mental health and also where the legal powers may sit with regards to restraining potential people in certain scenarios, which clinicians wouldn't be allowed to do and wouldn't be allowed to kind of manage certain situations. And I think I completely agree with the policy around right care, right place, and I think it's interesting that that's exactly the thing we're doing with general practice. with other parts of the system to try and encourage the right care, right place. So I would absolutely support a further conversation around how we all work more closely operationally and ensure that when our teams are under pressure, which I think is when the greatest risk exists for all of us, that's when the gaps appear and we all go back to kind of our own silos. I think one of the key things is for us to talk this through and walk this through, particularly with some of my mental health colleagues that are probably more knowledgeable about this particularly. So the idea that we can minimise the impact on the place, but also can ensure that there aren't any gaps with colleagues with other patients or communities, particularly, as I say, with regards to mental health. We're currently recording any incidents that are happening that people are coming across. I'm only aware that one has occurred so far, and I can certainly pick that up offline with you if that's helpful. But I'd certainly kind of welcome further discussion before necessarily ploughing ahead with this without really kind of understanding the potential knock-on effects. Thanks.
Lorraine, would you like to comment?
Hi, thank you. So I was coming in really on the first point regarding escalating when agencies don't agree, really. And just to say, we do have a clear escalation policy with the police. So I'm the operational lead for crisis team in Hereford. So you can imagine we're sort of dealing with this day in, day out. So obviously we'll call in for help if police are quoting policy and stating they won't deploy and we feel they should. We've got an escalation policy. We start at inspector all the way up to superintendent. And then after the event, we'll debrief at our interagency meeting group. Inspector Julie Watson attends that, and we'll talk through these situations where we feel actually police may have got it wrong this time. I've got a few examples of what
Excellent.
Helen,
Yeah.
is Lorraine back?
I'm back now. I think I froze then.
You did a few examples.
A few examples. So one example, last week we had a call from the member of the public who said one of their family members has left a note saying they want to complete suicide. They called 999 and police said this is a mental health matter, phone the crisis team, and gave them crisis team phone number. We're not open access yet. We're not commissioned to be open access. We don't give public our phone number. So that's the first issue. The second issue, this family member has gone off. The person wasn't open to mental health services, isn't open to mental health services. We have no idea who he is. And it's not appropriate for us to, to be looking after a MISPA. Where would we start? We haven't got access to ANPR or addresses, etc. So that's one of the cases. Another case, we had a patient we were carrying out a mental health act on in the A&E department with our Wye Valley colleagues, and he had completely smashed up the room and smashed his way out. We called police for help as criminal damage. There was a crime being committed, and I'm finding that as soon as you mention mental health, it's like a brick wall, and we have the policy quoted at us and the police wouldn't deploy. We have taken that through the escalation policy, and it has been agreed that police, should have deployed then. But it's just to give you a couple of examples, really. And again, we do not have powers of 136. So sometimes we will have a patient that has perhaps absconded from an assessment. We're really concerned about them. We feel they are an immediate danger to themselves or others. We call police. They won't come because it's mental health. But then we've got this gap because, okay, we could go and find them ourselves, but we have no powers to, put someone into a car. We don't have powers of 136. So that's just where we found a few of the gaps are.
Helen, I'll call Helen before I go back to the room for comments.
Thank you. Yeah, I was just going to back up what Lorraine said in respect of the escalation process. So there's an escalation process there and then at the time through our control room sergeant and inspectors, should agencies feel that the decision that's been taken is not correct. And again, like Lorraine said, that's escalated sort of slower time through our meetings. We have a monthly meeting both with A&E and with mental health services at which these issues and others are discussed. And as the PCC said at the start, no public service is perfect. There are absolutely occasions when we get it wrong. There are also occasions when we get it right. And just to give a bit of context, so we had just in the month of August, 308 incidents open where the opening type was risk to life. There was no other policing purpose to those incidents, and they were mainly calls from the ambulance service in respect of them not having capacity to attend incidents within their remit. And it comes back to what Mr. Campion said earlier in respect of, is it the police's primary duty of care? No. Is there a lawful policing purpose? No. And are the police the right trained people to go to those incidents? No, they're not. However, what I will say is we also recorded 353 incidents where we did not attend under the most appropriate agency policy, and 99 where we did, because we recognise that sometimes those gaps are created due to lack of capacity within partner services, and that it needs an agency to deploy. So, we are still deploying to some of these incidents. We're not saying no every time. And as Lorraine's pointed out, we're not getting it right every time, but there is governance and scrutiny around that. So there's a monthly governance board within our control centre that's attended by members of the OPCC. I think it's the assistant PCC that attends, where some of these incidents are discussed, where the general principles are discussed, and we make sure that our staff are getting it right and are, as this came into operation in April. The longer this goes on, the more that we learn, and the more we hopefully get it right and don't have the examples such as those that Lorraine has given.
Thank you. Simon.
Yeah, thanks, Chair. And some really interesting comments on what clearly is a very complex issue and quite a significant change to the way this works. So just in terms of other background information, so I've spoken to my colleague who works in Humberside, where this was piloted, as the report describes. He actually talks really positively about their experience, and that was a pilot, and this is now being rolled out nationally because the pilot largely was considered a success. So it's important, I think, we have a positive mindset for this, because we all agree we want our residents, our service users, our patients to have the right type of service. When they have a need, it needs a service that most closely matches that need. And I think that's really important. I'm very confident in the strength of our local partnerships that we can make a success of this. I think particularly if we all stay quite patient with the process, because it isn't going to be something we can just flick a switch overnight and it's that black and white that it'll be very clear who has to do what. Because as we've heard, there are lots of shades of grey in the examples that people give, where actually we need to learn and then understand how best to do that. My question, if John's going to come in next, so we implemented this in April. It's been a soft launch. I think we've done a really good job of walking people through the process. I'm interested in the main areas of learning really since April, and kind of how that's then going to change our focus during the second half of the year and beyond. That's okay.
Thanks, Simon. And you've hit the nail on the head for me, as it were, because who the Chief Constable deploys her resources to, in line with her legal powers and the resources she had available, is absolutely got to be her right, as indeed all the other sovereign bodies around this table. What you're seeing from the police, empowered by the Humberside example, and a lot of pressure from people like me and government saying, right, you've had all these resources, what are you doing with it, as it were, and crime and the central element that I think the public have invested in the reason for, it isn't in the area that we're talking about here. And as to whether or not mental health services are appropriately funded in this county, I don't know, but even I'd probably have a guess to say it's not appropriately funded for the demand that we have. So therefore, other services are having to either inappropriately or appropriately fill some of that gap. And it is what will happen anyway, because the police are doing it now. The reason why I'm here is to understand how, as we go forward, we align the different processes and the different budget cycles and the different commissioning of services to make sure that some of the gaps that are there and will appear to be there as time moves on, we can address if we are able to. It's not a massive reset where you press a button and everything's suddenly different. It is a trajectory change. And for me, I can feel the trajectory change, as in the police are doing something different and some of the partners are doing something different. And it's the point that Simon's just made, that actually, how do we then plan in that medium and longer term to make sure actually we have got the right things in the right places, make sure that the safety net element, which will always be there, isn't being overly relied on.
Thanks, those are all helpful. I think this sort of a soft launch in April, and actually with the sort of leader in this health economy, I wasn't aware of this until a few weeks ago. And actually, we haven't had the presentation at the One Herefordshire Partnership yet. That's going to happen in a few weeks' time. Obviously, there have been many more conversations with mental health. I mean, I guess the concern for me is, the worst thing that will happen, isn't it, is there's a risk either to someone else or to an individual from self-harm or worse, and between us we drop the ball because we're not sure about whose responsibility it is. And so we absolutely do need to work together, and I'm pleased to hear about the sort of the escalation measures that are in place, but I'm really, really keen to understand how well they're working, and have any instance happened, have anybody slipped through the net whereby they've harmed themselves or somebody else, and that could have been prevented. So it sounds absolutely right. We've got to work together on this. But I guess my last point would be, we are a small county with small public services, because our population is relatively small for the geographical area that we serve. And so I think we do have to be more flexible with each other, just as a matter of course, just because of that nature of all of the different services that I hear, in the same chunks as they are in very big conurbations, but there are just less people around and on the ground. And so I think we do have to have a mind to be much more flexible in the way that public services work together in Herefordshire, because I think that there are some relatively, not necessarily unique, but more unusual aspects to our very rural community.
Can I just pick very briefly up on some bits that Jane said, because I absolutely agree with what you just asserted. And it worries me, but reinforces a position I hold around you only knowing about it in recent times. And the danger is sometimes, and the police are no more guilty of it than lots of organisations, is sometimes stuff gets implemented because we need to do it, so therefore it will get implemented. And that partnership systems leader element to it gets missed. We are where we are. I've made a public statement about my concern about that and the like. That's a matter for the chief. I have an opinion and a statutory right to say so, but we are still where we are. And that bit now, as to we understand what's happened, but also shape the conversations, is the right one. And Herefordshire is of course special and unique, as all of my counties in West Mercia, but it's also got the advantage of the partners being really close together, whether it be dealing with floods, whether it be dealing with the pandemic, whatever it is. The partners know each other and get together. And I think if anywhere it can work, it is Herefordshire, because of that ability to work so closely together. But what I'm not yet seeing, Jane, is I'm not seeing the route map to make that happen enough of the time around these particular issues. Because I come back to, the police are doing it anyway, and we will always be the failures and the scrutiny that will happen afterwards. I suppose I'm really interested in where it started to work more successfully, so we can build on those case studies. And the very last bit for me, in terms of an offer as commissioner, I'm willing to put some skin in the game. This being successful will enable West Mercia to be more successful in its core mission. So therefore, I am willing, if I can support as commissioner, to do that. I just don't know how, because it's not my area of expertise.
Thank you. If I can just come back on that, and thank you for that offer. So I think in terms of the first question, our partner satisfied to fully understand the implications. I think the answer has to be no. As we sit here today, we don't fully understand that. We do need to have some broader conversations with all of the partners and the police, and saying we're having a conversation in a few weeks' time, and we may need to set something up a bit more formal that says, so how do we learn from this thing that happened? What do we do next time? The leadership question for me, though, is if the officers on the ground are being instructed to take a very hard line, or will they be instructed to take a very flexible approach and work with partners? So for me, it's the leadership question, and so what's the direction that's being given to the officer on the ground or in the call centre who needs to make a decision about what they're going to do about someone at risk? And so I think those are the sort of questions we need to talk about.
Just a comment, really. I watch, as probably lots of people do, a number of the ambulance programmes that are broadcast from various parts of the country, and a lot of paramedics also spend a lot of time going to call-outs which are to do with mental health issues which they do not have the training for, and spend many hours waiting for an appropriate mental health person to arrive in order to deal with the case, unless it's a case where there is a threat to life. And we've already mentioned, as John did, the fact that the ambulance service is very stretched, and therefore the police are more likely to get to a case than the ambulance service are, and I would probably agree with that. And they would probably say that that's because they're having to deal with a lot of cases which are mental health cases and not general health cases. Do you think that as a result of this policy, what will happen is that the workload that you were receiving as the police will pass over to the paramedics?
So my fear is that there is potentially some people who won't get the help that they need, because there are some huge waiting times on the ambulance side, or indeed, as Jane referred to, I think it was Jane or somebody referred to earlier, actually that service isn't open to the public directly. So therefore they might then live with whatever is going on rather than get the help that they need. The demand is there on the system, but it's just not in the right place, and indeed I don't believe it's necessarily got the right resource in the right place either to meet it. And I welcome the conversation today, but one thing I would hope we would be as an impertinent to suggest is how we're going to get that reassurance. That I think there's a conversation at the one Herefordshire, I think somebody has alluded to, how this board, with its statutory duty and the statutory footing of this board, is going to get the reassurance over some of the issues here, because my paper's not perfect either. Well, we talked a lot about not being perfect today. There will be other issues in there and risks and other bits and pieces, but it's how the bits that are in here, as far as we can do, this set of partners is reassured that there is either the right trajectory to understand, to know what we don't know, or indeed what we do know now, be reassured about the right things are happening as a consequence. And I would welcome the board's understanding of how it's going to reassure itself around that.
Before I pass to Jonathan, just a second point regarding Humberside. When you say Humberside has been successful, what are they doing differently to what we do now? So what can we learn from Humberside that will make things better? Because I'm perhaps I'm being too simplistic, but I listened to Lorraine Duet, the fact that the crisis, the number is not publicised, nobody knows it's there. And I think, well, who do you contact at 3 o'clock in the morning if there isn't a number? You contact the police, or you contact the paramedics, and so what would we learn that needs to be done from Humberside that we need perhaps to be considering in Herefordshire?
My answer is indelicate, so forgive the indelicacy of it. But the Humberside partnership was set up as a partnership around the shared problem of the demand not being met in the right place. And my fear is, and I've said it publicly, so I'm not giving anything away, that this felt as a police project to get going, and then partners need to catch up. Humberside was completely the opposite. It was going in a completely opposite way. But there's people here who aren't getting the right support, and it's ending up inappropriately somewhere. And the focus being on getting the right people, the right support, and that's very different to the way that it started here in West Mercia. Now, Simon alluded to, it is what it is. So therefore, let's understand what's happened and how then partners can, and it doesn't have to be exactly as it is in Humberside, does it? We're very different. But we can learn from some of them, but the way that they've set their project up is very, very different to how it started here in West Mercia. If I've got my crystal ball, I would suggest we probably would have been more successful with the Humberside model than maybe we would have been in the current model. But that doesn't mean that we can't replicate some elements of it.
Did you want to think, Simon?
No, I mean, I think John's right. This is always imperfect, this type of change process, isn't it? It never goes as you would like it to. I think one of the things that hasn't come out for me as well is clearly we're trying to get the right response. So some of that is going to be police work because of a threat to life or a threat. Somebody smashing up a clinic or an A&E department, well, that clearly is a criminal offence, isn't it? So that's still a police matter. Clearly some of this is professional mental health. And of course, the NHS 111 service is a key part of that. So ringing NHS 111, there'll be a triage element from the call handler, and there is the potential for referral into mental health services through that route. So whilst there's not a number like the police to ring for emergency mental health, NHS 111 is a really good means of accessing that service. But I think there's a whole other section to this, which is community resilience, safe and well-being, communities looking after each other. We used to talk a lot here about talk communities. There's a bit of that which we mustn't forget here as well, because it can't all end up as mental health professionals' work. We actually need to work with our communities to make sure there's a self-sufficiency, that people look out for each other, and for people that are a bit lonely or people that are a bit vulnerable because they're living on their own, they've really got a mental health need. They haven't committed a crime, but we must actually, in our thinking, try and capture that need as well, because it'll need all of those things for this to work over a longer period of time.
Thank you. Jonathan.
Thank you, Madam Chair. Yes, Jonathan Lesser, leader of Herefordshire Council. I thank John for producing the document and presenting it today. And I'm focusing my attention on paragraph 13, where it's the items where this policy is there to tease out where the most appropriate agency should come into play. And I think that's the ground that's the area we need to focus on. And it's great that West Mercia brought forward a policy, but in response, it's like all partners really should have a policy on how we deal with this moving forward, because here the answers aren't necessarily they're not necessarily clear. Given if you have a crisis point, that would focus the mind in a way that perhaps something less high profile would be coming to the surface. But I mean, unless we come up with a way of, as partners, dealing with the process and having a policy of response and everybody knowing who to approach in what crisis and for what reason, then this policy is going to be presented to us, but it's not going to have the traction that we all need it to have. And so, we just had the example there of a plea concerning suicide, but then the service provider doesn't have a front door where you can call. That was the example that I think was given. So we as an organisation need to have a roadmap as to how to deal with these calls and where they go in the event that they don't go to the police, and all partners need to be crystal clear on that. Otherwise, we're going to get this to-ing and fro-ing right at the point of crisis, which is the last thing we want. So I think we need really to make sure that we have a policy in place to cope with the requirements of this document. And I welcome people's comments.
I'll call Steve next.
Thank you. It's just obviously I'm the VCS rep, but there's a plea from the VCS in terms of where some of the organisations are in this space, and places like Venture would very much welcome to be part of the discussion in terms of retrofitting their support into what comes next, into this sort of collaborative response to it. So it's just a plea in terms of, whilst a lot of the focus is on the statutory sector, that the VCS have a role here and could possibly support and help what comes next. So just for my 10 pennies worth, thanks.
I'm not going to repeat what's been said, because I endorse everything that's been said. I think from an adult social care point of view, we're starting to see some of the operational impacts of the policy. And I welcome that opportunity for a broader multi-agency trajectory. I think you said in terms of how we deal with this going forward, so I'm not going to repeat, but maybe endorse what people have said.
Christine.
Yeah, a few points. I mean, the first one was going to be along the lines of the response that the community could have here. We already have things like Safe Haven with mine, and I don't know how well that's knitted into all the statutory agencies' response to signpost people to that. I think the other 2 points from the public's perspective is it feels like crisis means different things to different organisations. In a self-defined crisis, how do you navigate that? And I suspect the reason 999 is the number is because everybody knows that we'll get a response from somebody somewhere. And I do still think that NHS 111, whilst it might be the NHS version of a way to respond in every case, I'm not sure the public would think of 111 in a mental health situation potentially. So I think the comms needs to be thought through. If there is an approach locally to how this is managed, how do those calls get managed? Is it still 999, or is there a local alternative? And if there was to go down that road, we'd need to communicate really well and clearly with the public.
I agree with you. Matt.
Yeah, it's just picking up the point around partnership governance. So I know I've been having some conversations with quite a few people around the table about governance within Herefordshire more generally, and we have lots of groups already. So I think there seems to be a consensus around some kind of partnership to kind of oversee this. I guess it's how we maybe utilise those existing governance that we have in place. And we have a number one of those areas. It could be the community safety partnership that focuses very much on crime and disorder. We're just about to reinforce and establish a strategic mental health partnership group, so it could ultimately sit there. And then we obviously have the One Herefordshire partnership, which Jane just talked about. So we probably just need to work through, do we utilise those existing partnerships, or do we have a short task and finish group to kind of work through some of those things we've discussed today? So it's just an observation from me.
Thank you, Matt.
Madam Chair, so a comment from Lorraine Baker. It may be worth discussing the new mental health response vehicles that will be launching imminently.
Sorry, could you say it again? A bit louder?
From Lorraine Baker, it may be worth discussing the new mental health response vehicles that will be launching imminently.
Okay. Anybody else? Simon?
I was only going to make the point about the mental health response vehicle. So that's part of, as far as I understand, it's a West Midlands wide pilot where all of the health systems have had to provide funding to part fund. It's one or two, it's a very small number of mental healf vehicles. So I wouldn't want to get carried away thinking, oh, well, this is all going to be fine. Because as John just said, if it ever finds itself to Hereford, we'll consider ourselves quite fortunate, I suspect, as most of these West Midlands wide schemes. So just to provide a little bit of clarity on that point, we need a local solution to this that we own and manage in Herefordshire, that's driven by our partnerships, that's driven by the resources we've got and organising them in a way that can make this work for our communities. That's what I would stress that the committee focused on.
Do you think it's worthwhile? In November we've got a a slot or annual date for a sort of workshop? Do you think that would be worthwhile to use that time to get the appropriate partners around the table to actually discuss how we're going to go forward with this, whether we're going to set up another committee, or whether we're going to apply?
Can I make a helpful or an observation as to whether it's helpful or not? Can I agree with your point? We've got enough governance to govern us till the end of time. But the bit why I think here works for me in terms of why I wanted to come today is it's happening anyway. I know that a number of partners aren't necessarily happy with what is happening, so therefore it's about reassuring ourselves as to whether everything that could be done is being done, and I don't think anybody is truly reassured about that. And so my preference would be about some not necessarily at this level, but within our organisations, a bit closer to the tactical activity reassurance about those bits, maybe to start with. But the offer always stands from me to set up a new governance structure. I can happily support it from my office, but I'd say we're not there yet. But that is an offer a little later down the line. But some they say fast and dirty work to understand those immediate concerns might be more appropriate.
Just to an offer really, because I agree with you and with Matt was saying we've got enough meetings and structures in place. So and an obvious thing to consider would be the forum that I chair for One Herefordshire, which is the Clinical Practitioner Forum, partly because that is exactly there for the frontline clinicians and practitioners, bringing perhaps some of those cases that were mentioned in the escalation side of things and just walking those through. I really welcome that we have more local authority and police membership of that committee, because it is exactly that. It's to try and work out the niggles, the gaps, and try and think around solutions, which we can then take to part of the One Herefordshire structure. And that feels like it might be a good way forward. So it's set up, ready to use if you wanted to.
Matt?
Yeah, I'm still not quite sure where it sits, but I agree. I think it's below the strategic level, and I don't think the workshop in November, I think we'll have the same people around the room. So we've got to delegate to the One Herefordshire Partnership, and then I think maybe the December, it sounds like the evaluation is October. John, is that right? I think the 6 months evaluation, so maybe the December Health and Wellbeing Board. I don't know if that would be too soon, but then we just get some initial kind of reflection from those organisations in terms of progress has been made, evaluation of the outcomes to date, and then the board can just maybe review where things are at, if people think that's a sensible solution.
Anybody else have any questions regarding any of the bullet points that are on that John has referred to, either with regard to the ones on page 134, which is in the actual report that he's put together, or the report that comes before that, which basically asks the questions as to whether we understand exactly what is being proposed and how it's going to impact upon our organisations. No? So, Henry, have we got some recommendations here?
The main recommendation I took from that was Matt's recommendation about having an item of the December Health and Wellbeing Board meeting.
I think we just, I don't know, Jane, you comfortable with One Herefordshire Partnership, like kind of delegating and coordinating how we kind of...
Yeah, I agree. So we've already got the initial discussion with the police and mental health services that's set up, and I think as part of that we then need to agree, as you say, whether we task and finish group or who we need, but then we should be able to find some assurance back in December on our thinking of where it is and what sort of risks, are.
I would welcome an invite to my office to the One Herefordshire meeting for that item if possible, if there would be any assistance.
Jonathan?
Yes, I was just wondering though if operationally there could be a meeting before that.
Yeah.
Because it seems to me that time is of the essence and everybody's diaries will fill up with meetings, but operationally I think partners need to have an initial meeting to iron out any immediate concerns so everybody knows where we stand.
That's what I just suggested, actually.
Oh, right.
Yeah, I think that's what we're suggesting. We're just getting the right people in the room, and we'll bring our colleagues with us.
Okay, so what have we got now, Henry?
So to have a one heritage partnership meeting, to delegate the item through, and then to bring the item back to the Health and Wellbeing Board in December.
Right, okay.
Anybody else got anything they wish to comment on before we go to the recommendations? No? Well, thank you, John, for your presentation and for your honesty about the issues where you don't actually have the answers, and other areas where you're unsure whether you've got the answers. That's very helpful. Might not be very helpful for you, but it's helpful for us to know. So thank you very much. So we move on now to, we've got the recommendations, and I will propose the recommendations. Do I have a seconder? Yeah. All those in favour? Any against? Any abstentions? Thank you very much. We now move on to item 11, which is the update on the work of the Oral Health Improvement Partnership. And to present this is Harple.
Thank you, Claire. So you've seen the report in your pack, so I'm going to go through some of the key points of the report. So the purpose of the report was to update you on the work being done by the Oral Health Improvement Partnership Board. Oral health is obviously of high public health importance. It has a strong evidence base around populations at greater risk of poor oral health, include those living in social deprivation, those that have learning disabilities, experience mental health, and need adult social care. The oral health of the local population remains slightly worse than the regional and national averages, and this hasn't changed. So the Oral Health Improvement Board aims to deliver on the recommendations made from the Health Needs Assessment, which was published in 2019. The board was restarted in 2021, post-COVID, and is meets quarterly and is chaired by the public health consultant. And we have system partners across the system, including Healthwatch and NHS England, that attend. Some of the key areas of development are that there's good activity at system level, including a new dental service for Hereford, which is called the Golden Hello, which is currently looking for premises now. Across children and young people, there's the Time to Shine programme, which has evidenced some good activity across Herefordshire. So we have free online training for parents. There's over 3,000 packs of brush, book and bed have been distributed across the county, and there's evidence-based supervised toothbrushing program for young children. However, despite those good activities across the area, the recent results from the survey showed that decay in children aged 5 have increased from 33% to 38% in 2022. So over a 10-year period, we have seen that increase in decay. So there are some challenges there. Some of the activities I mentioned have good evidence base and will continue to be worked out through the action plan. However, there are some areas that we could further improve, and they will also be explored. So some of those areas that could be explored further is fluoride varnishing and fluoridation of water supply. And we recognise there are challenges across some of those activities. That's something that we want to explore a bit further.
Thank you. Any questions? Fine.
Yeah, just a couple of points, just to reiterate. I don't think it's called the Golden Hello Dentist. It was a particular initiative that basically paid an additional upfront payment for people willing to come and set up new dentistry, and that actually is going to give us 2 new dental services in Herefordshire, the first of which I don't think we've had any new dental provision in Herefordshire for much of the last decade. So it's a really positive step forward, actually, particularly in relation to oral health. I was just going to ask a question around fluoridation, because This doesn't seem to be a local decision in the way that it used to be, but when we've talked before about oral health needs assessments, Herefordshire really does quite poorly, actually, particularly for child dental health. And actually, the two areas that perform the poorest, I think it's Herefordshire and Stoke-on-Trent or Staffordshire in the Midlands. Neither has fluoridated water, so it would be remiss not to have a conversation about developing oral health and not to stress that point around water fluoridation, because there is clearly a very definitive link between the two.
Matt?
Yeah, no, absolutely. I remember I come here to my first health and wellbeing board just over a year ago.
I think I was there as well.
Committed to look into fluoridation, and there's been challenges because the local powers that devolved to local authorities to resolve fluoridation, local authorities just weren't acting on them. So it's escalated up into government. We're still waiting for a lot of the government to kind of understand what that process is, and that's really what we want to do in that paper, take it to that next step and ask them what can we do. We need to have local consultation. We've got multiple water supplies in Herefordshire. We've got private water supplies as well. So I think there needs to be a bit of work and a bit of lobbying, I think, particularly if the Health and Wellbeing Board really want to do that, to say actually Herefordshire, this might be an opportunity for them to actually add fluoridation through the water. But I think we need to come back to the board to say what the options are and what the process is, because we're still not any clearer from government at the moment. Which is incredibly frustrating because actually this is so preventable. And I'll keep going, can I just keep going? Because I think actually there's some really great work going on in the public health team. I think we need to acknowledge that we're doing what we can in terms of some of the work, but clearly it's probably not enough. And I think fluoridation is a real good opportunity for us to explore.
2 points I wanted to make. One was on fluoridation, and I do think there will be a challenge amongst members and others about it. I came from a county that did have fluoridation, and to be perfectly honest, I didn't know when I came to Herefordshire. I didn't look it up before I moved here to check whether it had or not, and didn't know until very recently that it didn't have. And I'm not sure that when people move from one county to another, they actually check whether that's an issue or not. So although I think there are people that have strong views about it, I'm not sure when it comes to moving house or something like that, that they actually take that into consideration. The thing for me in this report that I have banged on about when I was chair of Children's Scrutiny is the fact that for the rural areas of Herefordshire, which are areas that I represent, if you don't have a car, if your only car is your partner's car and you're the one that's got to take you, and there's no public transport, then getting to a dental practice, even if there is one available, is almost impossible. And yet we have in my ward at least one, if not, in my ward, we certainly had one quite large GP practice that could easily house a dental practice, but doesn't. And I know my adjoining ward, there was a similar situation as well. And I've always wondered why we've never, in fact we have, not thought about a mobile dental service for the rural areas. Because, if you live in Downton on the Rock or up in Linden, places you've probably never heard of, to get to a dentist in Leinster without transport is impossible. And that may be part of the reason that our figures for children are so poor, is because even if we provide dental surgeries, people can't actually get to.
Jan. Similar experience to others, I think. Is that I think I came to a Health and Wellbeing Board when I first came to Herefordshire just 7 years ago, and it was being discussed then, and there was a question about why don't we just fluoridate the water then, and it just feels there isn't, frankly, the political will to get it done, and so I just think everyone needs to think about their responsibilities to get this done. There is clearly harm to children from not in the water, and so I think that's a challenge to the council that I would put out. And then I've got a smaller point, which is around, it says in the report around the oral health check for all babies at 4 to 6 months. Is that part of the new health visiting specifications? Okay, thank you. Steve?
So I was just going to, it might be a naive question, apologies. Is there a link or a correlation to the childhood obesity data in terms of, are the hotspots the same?
No, I've asked that question though, Steve. It's a good point. I don't think there's any direct correlation. There's some correlation between oral health and obesity, but we've not been able to map that through the data. But that's something I have challenged NHS England and other consultants there. But we can look at that and follow it up.
Yeah, just to really comment really on it's good, firstly, good to see some of this come together. I agree with obviously the fluoridation bit. But one of the areas I'd also encourage for us to look at is what we can do to encourage dentists to come into the area as well as the golden hellos. Although I do like the idea of a golden hello practice. That does sound good. I'll certainly sign up to that. It was just in regards to for dentists, is, the expectation, much like GPs, is actually to not only run a clinical practice, but to run a business. And so, excuse me. So one of the suggestions I still think is let's make it easy for dentists to come to Herefordshire, and let's think around how we can support that back office, the support services that are often provided by private providers. And I think there's something perhaps we could do for ourselves. And I just think that's something which perhaps should be added onto the plan, and we can look at supporting them. Because I realise that many dentists have private companies set up behind the scenes, and of course the national contract we probably can't influence directly locally, but obviously that hopefully will change as well. So certainly happy to support any of the conversations, which I think I have raised that point before, but I don't, we haven't taken that any further. I don't think, and it would be welcome kind of doing so. It's seen as a positive.
Anybody else?
Yes, just to say, I have 2 young children. One of them is under 5, so the book bed campaign really worked, and it's really good to see. And getting young children to practice brushing their teeth at that critical age, I think is absolutely vital. But one of the things I'm keen to just know is, focus on water, but is there focus on other drinks? Because that seems to be part of the problem, does it not? And what advice are we giving to families about when to drink, what type of drink? And if you're drinking drinks and then having big long breaks between then and brushing time, then the harm that would do may be something that we need to explore further.
Yeah, we're happy to come back to that. So I think there is some work going on. One of the things we want to do is develop kind of the healthy setting standards as well for early years as well, and that wider promotion of healthy drinking. You're right, it's like many public health issues, they're multifaceted, and it's not kind of one single solution. If you put all these kind of interventions in place, you're likely to have a desired impact. So there is some work going on, but I think we could do a lot more around that. And a large part of that is regulation of the industry is a site in itself, so it's really difficult for some people to make individual choices on drinks, and actually they're a lot cheaper, some of these fizzy things and drinks. So we can certainly do more around education, I think, and wider awareness.
Just to be clear, Chairman, I'm not advocating to ban drinks. What I'm saying is the right time to drink a drink, if it follows your meal and then brush time, rather than just rely on drinks and then go the whole day without brushing your teeth. And it's the impact of certain drinks when they are consumed. So it's just making that aware for parents and families.
Anybody else? Can I just ask a question about the fluid varnish applications, which when I last looked at this subject, which would be about 3-4 years ago now, seemed to be very popular, and lots of dental practices were offering it and promoting it. Is that still the case, or does that seem to have dropped off now and become out of fashion?
It's the case. I think the point that we're making in here as well is that we can train dental nurses as well to apply the fluoride varnish, so that therefore we could increase the outreach of the amount of application that can be done. But fluoride varnish is still happening.
And do we publicise that sufficiently, do you think? That is available?
Yeah, we're going to have to take that one away. Thanks, Glandy. I know that my understanding is I don't think it's done as much as it used to be done. And again, it's another preventative treatment which we think would actually add some value. So I think that's probably something we need to take away the Oral Health Improvement Board, just to understand what that current provision is like.
And the reason I ask is because there are people obviously who do not, out of principle, accept, if they can avoid it, fluoride in the water, because they see that as a compulsory means of putting something into their water supply. And I'm not of that view, but I know there are some people. But if you publicise the fact that children can have this, then that is a choice decision that parents can make, which I think will possibly be a much easier thing to achieve than trying to get through the fluoride issue.
Yeah, like I think we have to look at all these different options on the table. I think the pros and the cons, and if we were to explore fluoridation, then there would be a public engagement exercise as part of that. So, like I said, I think we have to look at a multifaceted approach, whether it's timings of drinks, whether it's fluoridation, whether it's varnishing, whether it's teaching people to brush their teeth properly. So I think in a round, it's all those things. But people have their different views, and I think we as a board, we need to work through that in terms of what does the evidence say makes the biggest impact on our population, because oral health has big ramifications for the NHS, as well as individuals and have poor oral health. So it's
not just drinks, is it? It's fruit as well. I think it's important to know that it's not just drinks, it's fruit as well. Somebody else said, Christine.
Yeah, so I just wanted to come back on the fluoride varnish. We hear from the public that the issue is getting access to dentists in the first place. So I don't think the issue is that we're not publicising that people should come and get their children varnished, but it's getting through and getting an appointment for these things. And on that, I just wondered whether, question for Simon really, about the ICB now being in charge of commissioning for dental, whether that is going to present some real opportunities for you to commission differently and to consider more creative ways of doing some of these services that aren't traditionally, you don't have to be seen by a dentist for some of them, for example.
Happy to come back on that, Chair. Yeah, I mean, look, so dentistry was commissioned, paid for, arranged nationally up until 1st of April, where it's been devolved down to local level. So we pushed for the golden hello. So they've been advertising contracts for people to come and run dental services in Herefordshire forever, but no dentists want to come and provide the service because there's just not enough money in it for them commercially to be viable. So clearly you need to do something differently. The incentive to help with setup costs, which is what the golden hello is, was the first part of some more creative thinking that we hope to apply to this. I mean, to be honest, your suggestions of mobile services, it's really difficult to set up services like that, but that's not impossible. And absolutely, Christine, I would be looking for us to think outside the box really, to find different ways of solving this problem. I think my only reflection, to go back to what I said earlier, in terms of wider oral health, a bit like we could have the best access in the world, but oral health in children won't really improve until we make some big steps around water fluoridation. I mean, Councillor Gandy, to pick up your point, I live in the north of Worcestershire as well, which is where I think you used to live, and there's even a stark contrast between the north and the south of Worcestershire, and the south of Worcestershire largely doesn't have water fluoridation, and the north does. So the evidence is very clear. So I would, yes, we can improve dental access, and yes, we'll do everything we can to be really creative about how we do that. And yes, Herefordshire is the top priority because, the word dental desert is the term they use because it's just really hard to get a dentist in Herefordshire. And we need to resolve that, don't we? But we also need to look at the other elements of this plan because they're all just as important as the access, aren't they?
Yeah. My dentist is in North Portchester.
There you go.
Still. Anybody else got any comments to make? You got any recommendations on there, Henry, other than what I printed on the paper?
There was the recommendation made about taking away chloride varnish to the Oral Health Improvement Board, but that's something we want to do.
Yep.
There was also something that Steve mentioned about childhood obesity data and about there being a correlation, and also Matt suggested about
look at that.
looking into that further.
Okay.
There were two that I picked up.
Anybody else got the other recommendation you think we should add? So the recommendations as they stand are two that Henry's just referred to. To note the progress of the Oral Health Improvement Partnership Plan, continue to support and deliver the Herefordshire Oral Health Action Plan, and to support the work to explore fluoridation of the water supply in Herefordshire. And I will propose that those recommendations. Do I have a seconder? Christine? All those in favour? Any against? Any abstentions? Thank you. We now move on to item 12, which is the launch of Herefordshire's joint local health and wellbeing strategy. Matt.
Yeah, thank you, Chair. Very shortly for this one. I think we just wanted to bring to the board to celebrate the launch event, which we held in July, which I know many of you were part of, and Councillor Esther kindly chaired it in the absence of Councillor Gandy. So it's really just to acknowledge the success of the event. So we had over 100 people that attended from the public sector, voluntary sector and private sector. There's a real good lively atmosphere, I think, in terms of coming together, particularly after the COVID pandemic. So people were really pleased to be in a room together. It's great to share the new strategy. And I think it's really good to have a focus on the two priorities, which the board will recollect as the best start in life and good mental wellbeing across the life course. As a kind of an addition to that, lots of the participants fed into what actions could be delivered to fulfil those two priorities. And we're writing those up, and two delivery plans against those priorities are due to come to the Health and Wellbeing Board in December, which we're hoping to get signed off. In addition to that, just to let you know, an easy read version of the Health and Wellbeing strategy has now been uploaded onto Herefordshire Council website. And just in Appendix 1, we just included some photos of the event, which really brings it to life. I think where we kind of used Play-Doh to really illustrate what health and wellbeing means to different people. So again, I think that brought a bit of fun to the event as well. But overall, I think it was a successful event. I think Councillor Lester and I talked about maybe holding annual events such as that. So we come together and actually look at progress against delivering the health and wellbeing strategy. And I think we talked about that as a board before. Once we've developed the strategy, we just keep an eye on that, and that's really very much in our board plan, which we'll come on to on the next agenda. But happy to take any reflections from anyone, but I think it was just more of an acknowledgement really of the event itself.
Anyone have any comments? Who was at the event? I unfortunately wasn't able to be there, but I did forward the video to all councillors and got a significant feedback about how good it was, and comments such as, you know, this is all very positive stuff and it's great. You know, we quite often just get the negatives of what's happening in Herefordshire and not the positives, and this demonstrated clearly the positives, so we must do more about showing the positives that we are doing, particularly within health, around in Herefordshire, rather than, you know, just having the headlines grabbed about what we're perhaps not doing so well. So I think, you know, the putting together of that video was first class. And I thank all those that were involved in that event. That was very, very good. So we will have a recommendation then that we have an annual event. Okay. Anybody else have any comments to make? No, everybody's satisfied. So then I will propose, that's the only real recommendation. I'll propose that recommendation as I suggested. Do I have a seconder? Jonathan? All those in favour? Any against? Any abstention? Right. We now move on to the work programme, pages 165 to 166. We've got provisionally in November the opportunity to have a private development session if we wish to do so. Does anybody have a view about something we could look at in November? I'm working part of November, but not all of November. Well, we don't have to have a meeting for the sake of a meeting, but if there's anything specific that we think will be worth looking at in more detail. No? Okay, well, we won't then. So the next meeting is the 4th of December, which is quite a big agenda. And then you've got the dates for the meetings through to December 2024. I'd like to say that as from this meeting, I would like all future meetings to be face-to-face, and that you only attend virtually if you definitely are unable to attend in person. I think in-person meetings, you gain much more from it, and we need to start getting back to actually talking to each other rather than a screen. Okay? Well, if there's no other business, I move to the next scheduled meeting is the 4th of December at 2 o'clock. So I formally close the meeting. Can I check with Democratic Services team